We are in AccuGuide and we are in the module U plan. A virtual workshop has been done to replace the missing tooth, and we've been planning an implant in position 46. At this step, we need to fabricate a surgical guide to place this implant inside the bone in an accurate and secure position. To do this, we need to overlay a plaster cast over the existing CT scan image because of some scattered images, because of crown and bridges, metal fillings and all that. We have some scattered images and the plaster cast will be much more accurate. We go to U-treat, we go to imported objects, and we have two ways. We can import another CT scan, which is called a double scan technique, or we can import an image of a plaster cast. We click on this and we go to select the plaster cast of Caesar. On one side we have the plaster cast image with the teeth, and on the other side we have the image of the CT scan. We are going to move this image in the right position, and we are going to make spines on one side and on the other side. On one side, same side, canine, premolar, molar, and then I do the same on the other side. I click here on the canine on the other side, on the premolar, and in between the molars. I can now compute the registration, and it's calculating to overlay the plaster cast over the CT scan. This will give me an accurate position of the teeth, and we have some colored and white surfaces. This means that we are accurate. I validate this, and then we go to U-Design. In U-Design, we have the plaster cast overlaying the image of the CT scan, the image of the missing tooth, and the planned implants. We are going to select a guide fabrication. On tooth-supported guide, we select the file, which is this image of the plaster cast. We go to a kind of guide, which is a spoon guide, let's say, double-click, and then we are going to choose the orientation of the guide. Orientation is important to avoid the overhanging surfaces. So I select this one, and then we are going to remove some matter. We are going to keep a good support on the teeth, and on one side is the expansion of the plaster, and on the other side I use this, which is a lasso again, very simple tool. I go on top, I remove this, I have a good support with a triangle support, and I can select this. On the other side, I remove slightly at the back, I remove in front, and that's it. What we have is almost a guide which has been fabricated, and we are going to work in a different way to finish this work. We can validate that, and then we can send it. If you want, we can see it over the plaster cast, and we know exactly how it's been done. So we can remove the imported objects, we can remove the image of this, and then we can see the plaster. We can see the guide overlaying the plaster cast. We can cut here, cut there, and we have the good access. We can also remove the images, and we have the tooth which has been made like this. This can be now exported. We use U-Order, and we can export that to our CT scan, our dental lab, to fabricate the guide on their own way.